All right, guys, COVID update. Today, I would like to talk about COVID antibody testing. So, the other day, I was driving into work and I saw an advertisement to be tested for COVID antibodies. Now, I'm an ER doctor and I've seen quite a bit of patients who have had COVID or have been exposed to it. So, although I wear personal protective equipment, also known as PPE, I was interested to know if I had developed any antibodies due to my high risk exposure at my job. So I went into my doctor, made an appointment, and I had some blood work drawn, and they called me back in a few days and told me I was negative. Now, what is a COVID antibody? So, a COVID antibody is typically what we're testing for is determine if you have had the infection or you've been exposed to someone who has had the infection. Now, we're looking at past tense, and I really want to distinguish that from the regular COVID test that we're normally used to hearing about. So, a COVID test, if you have symptoms, if you have all those fever, chills, cough, shortness of breath, loss of taste or smell, so if you have had symptoms that are consistent with COVID-19, then you should not be getting an antibody test. You should be getting a COVID test. And what that consists of is you going in to get a nasal swab, they send that sample away, and that's how they test for it. So, these are two different tests. Now, what does it mean if you have a positive antibody test? Now, if you have a positive antibody test, all it says is that you've either had the infection or been exposed to someone who's had the infection. And I want to make this real clear. It does not mean immunity. So a lot of people are like, yes, I have antibodies. That means I can't get sick again from COVID. No one has said that. That is not something the test does. All it says is that you have had infection or been exposed to someone that has infection. And it would be prudent of your doctor or urgent care, wherever you can get this test done, that they would probably counsel you on that to make you know that this test does not say you're immune or offer immunity. Now, if you have a negative test, all that means is that you've not been infected with the virus in the past, and you should continue what you're doing in terms of wearing your mask and social distancing. Now, how long does it take for your body to develop antibodies? So the scientists say maybe 1 to 3 weeks, but there is some data to suggest that it could be even longer. Now, if you have had COVID and you go to get an antibody test, does it mean that you will have antibodies? Unfortunately, it does not. There are some patients who have had COVID and have not mounted an antibody response. So just because you have had COVID does not mean your body will develop antibodies. So what's the takeaway? During this time, if you've had like a common cold or symptoms and you're not sure, have I had COVID? Have I not had COVID? This is a perfect test that you should get. And this will tell you, hopefully, if you've had infection. Now, remember, it does not mean you are immune. So a positive antibody test does not mean immunity. So continue to wear your mask, and hopefully you can go and check out my other video on how to wear a mask and continue to social distance. Be safe.